19.2 million COVID-19 infections recorded in the U.S. as countries in Europe see some of their highest daily new case counts since the pandemic began. To talk about the virus now tonight, we're joined by Dr. Robin Colgrove, infectious disease specialist at Mount Auburn Hospital. Dr. Colgrove, thanks so much for being here with us.
My pleasure.
Well, so health officials had a lot of anxiety over this period of time, the Christmas holiday and this week, people traveling to see loved ones. For people who fall into that category, they did travel. If they were exposed, how soon might they know and be feeling it?
Yeah, the typical incubation period from exposure to symptoms is somewhere between 4 to 6 days. There is a long tail after that. A few percent of people are longer than that, and even out to 2 weeks, there are a small number of people, but basically 4 to 6 days is the main window.
Okay, so Dr. Anthony Fauci has said he believes the worst of the virus is still yet to come. Has there been discussion among your colleagues right now about where we are? Do they agree? Are you preparing for this possibility?
Everybody thinks that we're nowhere near the peak of the surge yet. So the surge was already happening, and then Thanksgiving added to that, and then Christmas will add to that. So it's wave upon wave upon wave. So we are definitely preparing and getting ready with surge capacity all across the Boston networks.
Well, back to kind of the question about traveling. Massachusetts requires people to quarantine for 10 days if they traveled or get a negative PCR test within 3 days before they come back to Massachusetts. And there's always confusion about timing. If a person is infected, would they get a positive result necessarily in 3, 4, even 5 days? I mean, you talked about it could be up to 2 weeks, to even have symptoms.
Yeah, maybe not, maybe not. So you're not out of the woods for a while. But so if a person is exposed on day 1, there are not going to be enough viruses there to be detected. And on day 2, after the first round of cells are infected and making new viruses, still not enough virus there to be infected. It's really only about 3 days after exposure that you start to pick up some people, and only 4 or 5 days after that. But a negative test at 5 days, although reassuring, is not out of the woods, because some people will continue to turn positive for several days after that.
Okay, and finally, this has been in the news a lot, concern about that variant of the virus detected in the UK that may spread faster than the other variant in South Africa. Is this concerning, or is this just natural? We know that viruses do evolve. And then what does this mean in terms of the effectiveness of the treatments we have?
Yeah, so I would say this is not just what viruses do, this is what all life does. This is the essence of evolution by natural selection. So any new organism, whether it's a person or a virus put into a new environment, some variants will grow better and some will be worse. So the ones that grow better, and they will accumulate. So that's what we're seeing now. I guess as a virologist, I would say the somewhat hopeful message is that in general, what we see with pathogens is when they jump into a new environment, so in this case, SARS-CoV-2 from bats into humans, over time they evolve to become more contagious and less virulent, make people sick less, which is what you'd expect because people who are really sick aren't out and about transmitting. So it's not a perfect rule, but overall with pathogens, we expect this to happen.
For them to be less contagious, but potentially less fatal, more contagious, but potentially less fatal.
Correct.
Yes.
Yeah.
Okay. Dr. Colgrove, thanks so much for your time tonight.
Bye.